A 68-year-old man presents to the office because of difficulty swallowing that has gotten worse over the past month. He has difficulty initiating swallowing and often has to drink water with solid foods. He has no problems with liquids. The patient is accompanied by his wife, who is concerned about her husband's halitosis. Adding to his wife, the patient had a recent episode of vomiting where the vomit smelled really bad and contained food that he had eaten 2 days before. The patient's blood pressure is 110/70 millimeters of mercury and his pulse rate is 72 minutes. On examination, his abdomen is non-tender with normal bowel sounds. A barium swallow study reveals a localized collection of contrast material in the cervical region, suggestive of an outpouching. Which of the following statements best describes the lesion seen on the barium study? A. Persistence of an embryologic structure. B. Outpouching of all 3 layers of the esophageal mucosal tissue distal to the upper esophageal sphincter. C. Increased pressure above the upper esophageal sphincter resulting in a defect in the wall. D. Failure of neural crest migration into the Auerbach plexus. E. Inability to relax the lower esophageal sphincter. Result: correct. Explanation: correct answer C. This patient's symptoms of dysphagia with solid foods, halitosis, vomiting of contents eaten a few days before, and radiographic features of a localized collection of contrast in the cervical region are suggestive of a Zanker diverticulum. This is a herniation of pharyngeal mucosal tissue due to esophageal dysmotility and impaired swallowing. The cricopharyngeus muscle acts as the functional upper esophageal sphincter, this false diverticulum, consisting only of the mucosal and submucosal layers of tissue. Most commonly occurs above the upper esophageal sphincter within the Killian triangle, an area between 2 parts of the inferior pharyngeal constrictor. The most common symptoms are dysphagia, pharyngeal obstruction, and halitosis. A Zanker diverticulum most commonly occurs in older men.